Hello everyone, welcome to Health4U by UV Media. Myself, Dr. Rajdeep Singh Bagga, working as a spine surgeon in Indore and various parts of Madhya Pradesh. Today we will be talking about osteoporosis, या जिसको कॉमन हिंदी में अपन बोलते हैं हड्डी कमजोर है, जो कॉमनली अपन कहीं पे भी किसी डॉक्टर से मिलने जाते हैं, पेशेंट हैविंग क्रोनिक बैक पेन, लेग्स पेन, हैंड पेन, शोल्डर पेन, अपन बोलते हैं कि क्यों है, एक्सरे कराते हैं, बोलते हैं हमारी बोन वीकनेस है. तो व्हाट इज दिस ऑस्टियोपोरोसिस? क्या है ये बोन वीकनेस व्हिच इज डेवलपिंग एंड बिकमिंग मोर एंड मोर common nowadays? So what is osteoporosis? The official definition of osteoporosis by WHO is T-score less than minus 2.5 with an age-matched and sex-matched individual. But if I just talk in common terms, कि लेमन के टर्म में हम उसको क्या बोलेंगे, because nobody knows what is this T score, A score के साथ में क्या है क्या नहीं है. It is like जैसे जैसे बिल्डिंग पुराना हो रहा है, जैसे जैसे प्लास्टर बाहर आ रहा है, सीमेंट ब्रिक्स आर कमिंग आउट, that is how bones are gradually getting weaker and weaker, which increases the tendency of fractures and difficult healings and chronic pain in these patients. So we will be discussing osteoporosis in various study heads. जैसे पहले we want to know what is the pathology, what is happening at the micro level, and what are the risk factors of osteoporosis. Is it an avoidable one or it is unavoidable? And why we need to know about osteoporosis? What are the possible complications or after effects of osteoporosis अगर किसी patient को है? उसके बाद में treatment options and what is the financial burden people are facing because of osteoporosis nowadays. So first thing we'll go is pathology. Pathology, there are two types of cells. One cell makes the bone, other cell eats the bone. Why the other cell is eating the bone? Because we need remodeling. Bone बनता है तो जहाँ पे लोड ज्यादा है वहाँ bone ज्यादा बनेगा, जहाँ लोडिंग कम आ रहा है वहाँ bone कम बनेगा. That is why we need remodeling cells, and one is making cell. So over the time, eating part keeps on increasing, making part keeps on decreasing. उसके कारण धीरे धीरे osteoporosis or what you say bone weakness keeps on increasing. So what are the risk factor for osteoporosis? क्या कारण है जो osteoporosis को बढ़ा देते हैं? So what are the avoidable risk factors? Avoidable risk factors like diet, smoking, drinking, lack of exercise, all these factors can be avoided. और पेशेंट्स हैविंग क्रोनिक मेडिकेशन, जैसे पेशेंट लॉन्ग टर्म स्टेरॉइड्स पे हैं या इम्यूनोसप्रेसेंट्स पे हैं, these medicines also tend to cause lot of bone weakness, or you can say lack of cells which produce bone, उनका function कम करता है. Then second part which is unavoidable risk factors like with age, hormonal changes in females, genetic factors and long term chronic illnesses like muscular dystrophy जिसमें पेशेंट इमोबिलाइज्ड है, ऑन बेड है, पैराप्लेजिक है, लॉन्ग टर्म ऑन बेड है, मसल्स यूज नहीं हो रहा है. दिस आल्सो लॉन्ग टर्म नॉन वेट बेयरिंग ऑन द बोन्स, उससे कैल्शियम विटामिन डी कीप्स ऑन वॉशिंग ऑफ फ्रॉम द बोन्स एंड मेक्स द बोन वीक. So we'll come to the next topic. What are the possible complications? Why we need to know more about osteoporosis risk factor? Okay, hey, osteoporosis, what to do with that? Yeah, what problem it is going to cause me in the future if I develop it? So osteoporosis tends to cause frequent fractures, or you can say fragile fractures. अपन गिरते हैं, चलते हैं, minor trauma होता है, usually कुछ ऐसा issue, major issue नहीं होता, but once your bones are weaker, even minor trauma, minor fall or minor jerk also can cause you fractures. And these fractures are very difficult to heal. It takes very long time to heal. At the same time, lot of the time it end up non-healing stages, which makes even treating more difficult both medically and surgically, which takes a long time. Plus these patients usually have chronic pains all over the body, especially in weight-bearing regions, hips, knees, foot, even in hands and in the back. Small microfractures in the spine happening can cause you global kyphosis. Means your spine keeps on bending forward, which keeps on adding and cause more and more microfractures. So that is why we need to know more and more about osteoporosis. So next we want to discuss what is the treatment, how can I avoid osteoporosis, or if a patient lands up with osteoporosis, how to treat him. अब पहला चीज तो ऑब्वियसली इन मेडिकल साइंस इज प्रिवेंशन इज बेटर देन क्योर. So prevention includes both dietary and medical treatment. Dietary wise if I go, which you can say non-pharmacological treatment, जिसमें अपने को कोई medical या surgical need नहीं हो. It's regular exercises, avoiding drinking and smoking, having a good nutritious diet with a high protein diet, avoid falls once the patient is aging after certain age, like in females after 50-55 and in males 60-65. टेंडेंसी टू फॉल, इन कोऑर्डिनेशन, चलने में बैलेंस की प्रॉब्लम, या अपन चल रहे हैं तो स्लिप होने की प्रॉब्लम. सो जो फॉलिंग टेंडेंसी है तो ऑल प्रिकॉशंस हैज टू बी फॉलोड, सो इट शुड नॉट कॉज यू माइनर एंड falls and causing you fractures. So these are the non-pharmacological treatment options which are available. Pharmacologically, if I go, medically, there are basically everybody takes calcium vitamin D, but in an early age group, less than 45-50, calcium vitamin D is more than sufficient to surpass osteoporosis. But after certain age, if your kidney function, liver functions are everything is fine, medical management does not only include calcium vitamin D, but it is like an eaten cement. But there should be somebody who can put that eaten cement back to your bone. So there are certain injectable drugs which are now available with very good results with minimal side effects, which can increase the bone strength. Like it can activate the cells which makes the bone. और जो दूसरा सेल खाने वाला सेल है उसको कंट्रोल किया जा सकता है. That can reduce the tendency of having fractures less than 30%. Plus, it can definitely reduce the financial burden plus chronic pain burden of the patient, which is happening because of osteoporosis. In certain or minority of the cases which land up in fractures or certain chronic pain in patients which are like stress fractures, which is also a part of complication in osteoporosis, they may end up having surgeries. So having bone strength treatment prior to surgeries can make the outcome of these surgeries more fruitful compared to if the patient is just directly going for a surgery without any medical treatment for osteoporosis. Having said everything, there are certain financial load also due to osteoporosis. Osteoporosis prevent करने के लिए खर्चा कम है. Osteoporosis होने के बाद उसको ट्रीट करने का खर्चा is very much high, both medically and if rarely or unfortunately patient ends up having some surgery, that also increases the surgical cost very high compared to normal surgeries because of special implants which need to be used. More implantation is needed to get more anchor points. So preventing osteoporosis is much safer, better and easier compared to treating osteoporosis. For more such informative videos, hit the bell icon and subscribe our channel.